Okay, let me say good afternoon to everyone. Um, and this evening I have with me Mayor Pro Tem Dave Martin, Councilmember Amy Peck, Councilmember Edward Pollard, Councilmember Robert Gagos, and Councilmember Jerry Davis. Also with me is First Daughter Ashley Paige Turner, and then George Bunick of the Office of Emergency Management. And I certainly want to thank members of the media for being here today. And you've been extremely helpful in sharing COVID-19 information. And I want to re-emphasize again to everyone to get their information from credible news sources, because there are a lot of things that are being said, but please get your information from credible news sources. Today, Houston is reporting its 11th case of COVID-19. That's the 11th case. This case is a female in the 50 to 60 age range who is hospitalized. She has no known travel or exposure history, so this is likely another case of community exposure. And I really don't want to kind of focus on the numbers, because as more testing takes place, we certainly are anticipating the number to rise. But that's to be expected, and it will help us to get a better sense of who is out in our community that's walking around possibly with COVID-19. So I do want to encourage people to adhere to social distancing, social spacing, to be mindful of being around large crowds, and especially as we get ready to proceed into the weekend. So that's very important. And then today, as you know, Governor Abbott also provided some additional guidance for counties and cities across the state, helping to bring some uniformity across the board. And what it indicates, what it symbolizes, is that when we work together, we will be able to slow down. We'll be able to slow down the progression of this particular virus. And that's the key, to slow down the progression of this community virus such that our healthcare delivery system is not overwhelmed. But today I want to focus too primarily on a group that we haven't spent a lot of time in Houston and in this region talking about, and that's the millennials. Kind of want to focus on them because heretofore, we've been saying that the most vulnerable population has been our seniors. And they are our most vulnerable population. But what the evidence also indicates is that millennials are also impacted, and millennials can contract this virus. And if they're not contracting this virus, they can spread it to their parents or their grandparents. So I want to focus on the millennials, and we have several millennials that are here today. Ashley Paige Turner being one, Councilmember Peck, Councilmember Pollard being another. Do I see? Oh, Councilmember Robert Gagos is also present. So I want to know. So we have several millennials. I don't see any other council members that fit in that category. So, but that's where I want the focus to be for today, and then after we hear from some of them, then I will come back and specifically talk about testing. So first up, let me bring up the First Daughter, Ashley Paige Turner, with her message to millennials and that young group.
Thank you, Daddy. Mayor Turner. And even though there are only a few millennials on this stage, I know a lot of us are millennials at heart. So I brought a few of my younger friends with me today because we have an important message to share. Like everyone else, millennials have been paying attention to the COVID-19 pandemic and the City of Houston's work to mitigate the spread to avoid overwhelming our healthcare system. But as the younger generation, we have felt a false sense of security because we believed only older people were at risk of getting sick with the coronavirus. But increasingly, United States health officials have warning that millennials could also be at serious risk of complications from the novel coronavirus. Scientists previously thought young adults were largely spared, but some young people across the world, the U.S. and in our region, are and have the potential to become seriously ill. New CDC data shows nearly 40% of patients sick enough to be hospitalized were between the ages of 20 and 54. So, After seeing the images of college students on spring break crowding beaches or hanging out and not practicing social distancing, I asked to gather some young people from across Houston today to share this important message. Remember, most people who become infected generally experience only mild symptoms, such as cough and fever. There are some of my young friends. So you might appear healthy, but expose your older relatives or friends who have underlying medical conditions. And I will say this is a point in time where we do not want to be selfish. We don't want to only think about our social norms and being out amongst ourselves. I think this is the only time where we will not get the side eye for being on social media instead of being more active. And so let's take advantage of that because we really want to make sure that we protect not just ourselves, but also our grandparents, our aunts and our uncles, our parents, and anybody else that's close to us. So millennials, we also need to practice healthy hygiene habits. That means wash hands frequently with soap and water for at least 20 seconds. Use hand sanitizer when you can't wash your hands. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your coughs and sneezes with a tissue and throw the tissue away. If you don't have a tissue, use the elbow of your sleeve. Don't use your hands to cover coughs and sneezes. Avoid close contact with people who are sick, especially if you are at higher risk for coronavirus. Get plenty of rest, drink plenty of fluids, eat healthy foods, and manage your stress to keep your immunity strong. We're naturally, I think, a very compassionate and conscious generation. I think this is our time to put our compassion into action and to do our part as well to help mitigate this disease. So I want people my age and younger to take this seriously. With me today is Michael Conklin. There's Mike. Program Director of Evolve Houston, Christian Aguirre, a University of Houston student, and Scott Packer. Thank you so much, Mayor.
Thank you. To my millennial peers out there, I know that this is seen as something that really wouldn't impact you because it's just been affecting older people, but we're starting to see that that might not be the case. And whether this impacts you directly or not, you don't want to be the person to give this to the people that you love. And let's be honest, we were born in the age of social distancing. This is just like any other day for us, right? So let's all just take a beat, watch Netflix, order out from your favorite restaurants. It'll be okay. We'll get through all of this. Thank you.
To echo those sentiments, I just want my millennials to understand that you can be a leader. Be the first one to take those preventative measures. Be the first one to separate yourself. Let your peers know how important it is, and once they see you taking that step, they will too. So let's be in this together. Thank you.
Thank you. Well, I'd like to just share a message with my fellow millennials, and I'd like to start off by saying, you know, I've been hearing a lot about how millennials need to step up, and I agree. I think everybody needs to step up. It's not just millennials, okay? I think that what I've seen on TV, I see people of all ages who are not yet adhering by the guidelines, but this is really important. And millennials really should be leading on COVID-19 action. Leading social movements for the betterment of society is sort of our thing. And so I really feel like we should be leading COVID-19 action just like we lead climate action to protect the weakest and most vulnerable among us. I've heard people up here today say that, you know, it doesn't really feel real yet. And maybe that's why some people aren't really taking a leadership position on this yet. Some millennials, many of them are taking leadership position, but some aren't yet. And that's because it doesn't feel real until it does. And then it really feels real. I had one of my best friends sent me a text today with a picture of his son, little Sam. Little Sam was wearing a respirator and going in for a COVID-19 test. And that was a really scary moment. If it didn't feel real before then it really felt real when I saw that picture of little Sam. And my eyes still tear up when I think about it. And I share this story because when it feels real, then it really feels real. And we will all wish that we had taken more of a leadership role and done more to protect those we love. And again, millennials, social change, social movements, this is our thing. We can lead on this. We can do this for our families, for our loved ones, and I encourage everybody to do so because we all need to do it together. Thank you.
Hi everyone, my name is Christian Aguirre. I am 22 years old and a student at University of Houston. I recently came back from spring break. I went to Disney World in Orlando, Florida. I didn't think it was a big deal to go. Now, seeing the increase of cases and how fast it can be spread, I've come to realize that this is a big deal and that it takes all of us to stop the spread. For a lot of college students like myself, our classes are going online, which might mean more free time to hang out with friends at the park, more free time to hang out with friends at the dorms, more free time to hang out at home. However, I encourage everyone to stay home and practice social distancing. I mean, we all love being on our phones, so let's be smart and take advantage of the resources that we have in our own fingertips, like FaceTime, Snapchat group calls, and the party feature on Netflix. Thank you.
Thank you all very, very much, and I won't give you my age. I'm just right outside of that millennial age group. Tomorrow, Friday, the city of Houston will open one of two testing sites in partnership with FEMA. That will take place on tomorrow. The immediate focus will be on testing first responders and healthcare workers, but as we scale up, that will expand to others as well. And as you know, we've been approved for 4 sites in our region, 2 in Houston, 2 in Harris County, but we will be setting up or standing up the first one on tomorrow, and then we will scale up as additional supplies are obtained. It will be a free testing site, but we do not have enough personal protection equipment, swabs and other equipment to test everyone. So the focus tomorrow will be on first responders and healthcare workers. The public has been very patient, and I want to thank you for your patience, and we are asking you to follow the rules. And I also want to thank other private testing sites that have taken place in our city. I thought I saw Congresswoman Sheila Jackson-Lee, so I certainly want to acknowledge her and her efforts as well. First, people will be given, in terms of the protocol, people will be given a website address to answer questions. They will connect with a nurse, given an authorization number to proceed to testing site. These sites are only for high-risk groups with symptoms that have been through a screening process. And people who show up who haven't been properly screened will not be tested. But these are people who have been showed some symptoms, have gone through the screening process, and then as we scale up over the next week or two, we will be able to do more. We are making some very tough decisions in the city as well as the county. I certainly want to acknowledge and thank County Judge Lena Hidalgo for her efforts and the efforts of the county. They have been a very vital partner in this entire operation. We are taking deliberate steps to protect the public and save lives. That is what this is all about. And it's also important to maintain a healthy attitude, which is a part of a healthy regimen as we deal with a crisis of this kind. We're all in this together. We're all in this together, and we'll come through it much quicker if we work with one another together. So that's why the focus for today has been on the millennials, because we need them. Quite frankly, we need each other. Mayor Pro Tem, Councilmember Robert Gallegos, he's a little bit younger than some of us, Councilmember Jerry Davis. We all need this millennial group. Councilmember Pollard, Councilmember Peck, the First Lady, Mike Christian, George Bunick. We are all interconnected. And so when we work together, we are able to come through it. So making some tough calls. I want to thank the community as a whole for your cooperation, for working with us, for not panicking. But this is a crisis in which we have to manage. I tell people all the time, we can't see what we are facing. So it's kind of hard to kind of get your arms around something that you cannot see. But what we do know is that when we work together, when we engage in social distancing, spacing, avoid large groups and crowds, we're able to slow down the progression. So as the weekend comes, I'm asking people just to kind of find a way to enjoy yourselves in a small group in this new normal that will be with us for several weeks, if not for several months. So thank you so very much. Now that's where I'm going to stop, and feel free if you have any questions to any of us millennials, and then these older folk here, feel free to ask anyone. And the Congresswoman, she's Millennial Plus. Yes. Well, we got some equipment that came in via a truck from the Midwest that came in today. And then the governor did provide some swabs that came in on yesterday. So in terms of the PPEs and some swabs, we have enough to stand up the testing center on tomorrow. But this is a problem all over the country. And so the president, they just introduced the defense. What do you call it? The defense. The defense.
It is the Defense Production Act.
Defense Production Act, which is causing people to manufacture and produce these PPEs in the numbers I think that we will need. So it's a problem across the country, and that's what is delaying us from standing up all 4 testing sites, right now. In addition to that is that, you got a lot of people who are coming wanting to be tested, but you also have to have the labs that are able to evaluate and determine whether or not the swabs, the samples that they're getting are positive or negative. And that's also creating some delay. And so the City of Houston Health Department, for example, has brought in some additional equipment so that we can increase the number that we can do in-house, and we don't have to send them up to the CDC any longer. We can do it in-house. So we're all trying to increase our capacity on both ends. Testing, the PPEs as well as on the testing. The site tomorrow will be the Butler Stadium. That will be that site. And again, I want to remind people this, the emphasis for tomorrow as we stand it up will be first responders and healthcare providers. And then the way the protocol will be as we move forward is that we'll provide you with a website, and then you will go on that website and you'll answer some particular questions, and then immediately after that, you'll be placed in touch with a nurse, live nurse, and that person will ask a series of questions, and then you will be given an authorization number, and then you will proceed to the testing site. If by chance, for example, you don't have the ability to go online, then you will be given a number. We'll give you a number to call, and then we'll proceed from there. The first one tomorrow we'll stand up, and then we'll scale up, and then as the additional supplies come in, it's my hope that next week we can also bring those additional 3 testing sites online. So the whole goal is to ramp up, quite a bit over the next week or so. Well, that's a concern that, of course, the healthcare delivery system has been voicing for quite some time. With respect to PPEs, there are concerns on that end. With respect to the number of beds that are available, normally our hospitals are running at between 90 and 95% occupancy year-round. Okay, so that is the primary reason why we are putting in these significant dramatic measures of rescheduling or canceling major events, across the board. Restaurants, bars, clubs, all being affected. And the whole goal with all of those measures that's now taking place across the state, okay, and quite frankly across the country, is to slow down the progression of the virus, as we've said, to flatten the curve such that our healthcare delivery system is not overwhelmed. Let me tell you, if we don't do it, and all of these cases are coming in at the same time, our healthcare delivery system cannot handle the load. Let me just be very, very clear. If we all don't do our part, from millennials to those older to our senior citizens, the healthcare delivery system in the state of Texas, in the city of Houston, quite frankly in the United States, cannot handle the load. And so it's going to require all of us working together at this moment in time, like right now, to do everything we can to slow the progression of this virus. And even though, as of right now, for example, there are only 11 cases, and people may say, Mayor, that's not many at all in the city of Houston. Well, there are a lot more cases out there, and the numbers, as we do the testing, the numbers are going to rise. So there shouldn't be any surprise on that. But the reality is, I would like to think that because we are taking these steps to end these large crowds, to say to people, don't be gathering in large numbers, that we are slowing the progression so that our healthcare delivery system in our city, in our region, in our county, is not being overloaded and overwhelmed. Because if that happens, then you're going to have to make some very tough calls. So we don't want to get there. This is something for now that you have the power over your own destiny in part to determine how fast this virus spread. And so everybody now needs to be responsible. If you're thinking about, should I do this, but it doesn't sound like I should, I don't, then that means you shouldn't. Okay? If you have to question yourself as to whether or not I should attend this event, should I don't, should I not, you shouldn't. Okay? And again, this is for this moment, and then we'll be like this for the next several weeks. And if we're successful at doing this, then we can slow the progression, and that's the goal. Yes, sir. Well, let's put it this way. If everyone is responsible and does his or her job in terms of not engaging in large crowds and things of that nature, then we don't have to get to that point. I was pleased with what the governor did because that now applies the steps that we've already taken in Houston Harris County across the board. Because the reality is you can do it in this city and in this county, but if other cities and counties are not doing the same, then people are just traveling from one to the other. It has to be unified in order for it to be meaningful and impactful. And so now the same sort of guidelines, advisories that we've put out in Houston Harris County, Fort Bend, all of these counties in our region are now applied across the board. And that uniformity will benefit all of us, whether you're in rural Texas or whether you're in urban Houston. So let's just do our part. What I want to say to people, you don't want to put something in place and then people are rushing to the grocery stores because they're saying the city now is about to be shut down, because that was floating on social media. The city's about to be shut down, so we better go and buy up everything we can that can last us for the next 30 days. That defeats the purpose. We've got first responders and healthcare providers that need daycare, okay? The city, people are still calling because they have business needs. We still have to meet their needs. So let's just be responsible, and it's important for us to take very measured steps. And because it's important to, as I've said, we have to manage not only our physical presence being, but we also have to manage our emotions as well. Okay? So it's not just about the physical being, distance spacing, me from Mayor Pro Tem Martin, but it's also I have to manage my emotional and thinking as well. And that's important. So that's why it's important for us to have a good, positive attitude. And if we have a good, positive attitude, that too will help to keep us healthy. And then lowering the stress level. The anxiety is here. We're just trying to lower it a little bit. And I assure you that it'll help to keep you healthy. And then every now and then you just have to find a way to smile. You know, I know when my daughter saw me, I brought her joy. You see? So every now and then, even in stressful times, you just have to find a way to smile. Yes, sir.
I know we're spread out there on the stage, but we've got a lot of viewers at home that are watching right now and talking about practicing what we preach, and they're concerned about the fact that perhaps we aren't spread out enough. worries about that right now? What do you tell those residents?
Well, we are spread out. This room was specifically built for us to spread out and to do this. And the reality is, look, information is valuable these days. If we don't provide you with the information, people will get the information from non-credible sources. But we specifically built out this room in order to have a press conference like this. This room is normally, it doesn't look this way. But we built this room out specifically to have the social spacing to be able to do what we are doing today. Okay?
Just based on the question and the comment that the gentleman made about some people just not understanding and seeing it as real, if people still don't respond the way that they're expected to, is a lockdown on the table? Is that a possibility at all? And
Well-
also, a second question, what kind of support is Houston getting after President Trump's FEMA reunion?
Well, the support is coming in. I mean, just like tomorrow, there are additional supplies, additional personnel that are coming in to assist in this site, which is a FEMA site that's being stood up tomorrow. So that's very helpful. This is just a point in time. It doesn't matter, quite frankly, it doesn't matter who you are. It doesn't matter what your party affiliation, race, color, creed, language, whether you're documented or undocumented. We're all in this together. Every last one of us. This virus is not discriminating. This virus is not asking whether whether you're a native Houstonian or whether you just got here yesterday and you don't have your papers. It does it does not matter. And Houston has been through these, not this type of challenge. We've been through challenges before, just like Harvey. And in this city, we have all come together. So the only point that I would say, if we are responsible and we do collectively what everyone has been asked to do, then we can manage this without going to the far extremes, okay? We're trying to do everything we can to not go to the far extremes. Let's just be measured in our approach. And if we're measured in our approach and if we work together, we'll get through it. And the reason being, #HoustonStrong. Okay. Okay. Let me thank you all so very much. Let me thank all the participants, and then we continue to provide you with updates on where we are and what we're doing. Thank you. Appreciate it.